coming to you from sunny Queensland in Australia, so you can enjoy my accent. But what I'm going to do today is talk about, I guess, the journey that I have overcome with building sustainability and building the capacity and health to build sustainability in everyday business. So I was actually really fortunate to work with the ABC here in Australia and create a War on Waste video with the work that I've been doing. And that was just one day in my life, but actually that small portion of my life actually reached 4.1 million healthcare professionals and has created a real ripple effect across the way we look at health here in Australia. So I'm very proud of that journey. From that War on Waste video, I was able to leverage what I was trying to achieve, and I was able to actually head out to the market and actually look at what we could build in sustainability roles. And I'm actually now working for Children's Health Queensland. So that's the Queensland's only paediatric specialised healthcare service. And the reason why it's really important for me personally to work here is because I'm working with children. I'm working with the future of the environment. I'm working with the future of health. And that's why it's so paramount that I want to work where I'm working at the moment. But also what I was been able to do is just really build some quality improvements and practices and projects to build sustainable leadership in the hospital. So I'm going to go through some of those items, but in all of those things, what we have done is build an advanced recycling. I'm going to call it a revolution. We've made some procurement choices and transport choices that really align with day-to-day business changes. But we've also developed our very own environmental stewardship network, which has been key because that's about how we collaborate across such a big organisation to grab our staff individually and ask them to change how they work in our hospital. So how I've actually embedded and where I've started is actually looking at the GGHH guidelines and looking at how we can embed that in business as usual, asking staff what frustrates them at work, looking at what we're moving with our waste and how we're transporting, and really trying to investigate on a really focused level how we can embed those GGHH guidelines into our hospital. So how I've been able to do that quite successfully is through executive sponsorship and developing a quality sustainability plan that has set some really robust targets on reduction of clinical waste, moving waste out of landfill, looking at the way we use our energy in our hospital, in a plan that is embedded into so that every staff member in our hospital sees themselves in this plan. So it's about that call to action, which I will speak about quite a lot. The call to action is how do I engage everyone in my hospital to build this army, to be able to, in every section of every part, to actually build the capacity to look at our resources differently and conserve and use them respectfully. So I'm going to share with you today the top 5 standouts achievements, because I don't want to spend this time with you talking about the problem or talking about how much waste. I want to share with you some of the solutions that we've been able to achieve here at Children's Health Queensland so that potentially you can take some of these back and we can actually spread what was happening. So one of the first things what I was able to achieve, which is a really excellent leadership, is actually to remove the Styrofoam cup from our hospital. So Queensland hospitals have always had a very cheap Styrofoam cup, which is very bad for public health and also for the environment. And it's been really difficult because it's been a financial investment to remove that. And that's where that executive sponsorship has come in. So we have had a financial investment in our sustainability to remove the Styrofoam cup from the hands of our kids and families in our hospital and staff, and we've replaced it with a paper cup. So although that is insignificant in many ways, it's significant because we're the first hospital to make this bold manoeuvre with procurement when it wasn't mandated from outside the hospital. The second thing that I've tried to do and achieved very quickly is our Queensland Children's Hospital is right on South Bank in Brisbane River, and it's a beautiful place to work. So I've been trying to really run a campaign to encourage staff to use e-transport, bikes, public transport, and to encourage that I've been able to build a charging station for our staff. So that's to include electric travel for bikes and scooters and a bike transit hub, and it's all within a community notice board and building that staff capacity to encourage their own choice of how they get to work. The third thing I wanted to share with you today that's been successful in our 2020 was repurposing our resources. So looking at your resources differently to try and keep them in their virgin state for as long as possible. So not looking to recycle, that's down the list. The preference and the order of preference of disposal is really, really important to sustainability. So to be able to embed that across a hospital, I developed a procedure that has now clearly outlined the order of preference. So if we have something that's ready or due for disposal, the preference says we must find somewhere else inside our hospital to use that, And then after that, we have to find another Queensland Health hospital to give it to. And then down that list, we also actually have a sales. So we can actually sell some of our assets through the Queensland government website, which I've been successfully selling very random health equipment, things like thermal eskies, pharmacy, unused bottles. I've sold shower chairs, height measurements, scales, and also things like X-ray equipment. But this order of preference clearly outlines that when something's not being used in your department, we have to process it through a channel of preference versus putting it into the bin. So what I've been able to do as part of that order of preference is capture our resources that would otherwise have ended up into landfill, which couldn't be sold, and repurpose them and reallocate them into international aid. So this is part of what you're looking at here. This is part of just day-to-day waste within a large hospital. And what you're looking at there with those crutches is I'm building capacity, not just within our hospital to repurpose and reallocate equipment. Every child that's given a pair of crutches in our emergency for, let's say, their 6-week rehabilitation, they're encouraged and we advocate for them to bring them back to their outpatient clinics where we capture them, we rubber band them, and we send them off to third world countries. So that's really important part of actually trying to engage the wider community in the health solution. So what you're seeing there is expired consumables, lots and lots and lots of chairs that have perished due to COVID cleaning. And there was one lonely wheelchair on that image. And in all of that capacity in 2020, we sent 3 international shipping containers and they all landed out in the Pacific in Papua New Guinea. And they've actively set up 5 clinics in Papua New Guinea. It supported their COVID testing and prevention clinic, the TB clinic, the Cheshire Disability Services, their obs and gynae in Port Moresby, and then the Provincial Health Authority, which actually sends it out into the wider Papua New Guinea community. So everything that we would not be using again has found its space back into international aid with children around the world, which is really important when you look at some of the things that we are throwing out. They're still good. It's just that we are enjoying that first world health, capacity that we only use things once and then we can't use them again. So the next thing I'll talk to you about is the recycling revolution. So looking at our waste completely differently and not looking at as we have a waste team in a hospital, I like to refer to them as the recycling team. So these guys are there and girls, we're all there to divert this waste from landfill into recycling. So I've been able to develop 35 recycling streams, so segregating it into separate streams across and got our diversion rate up to 42% from landfill. And the only way I've been able to do that is from that call to action across all of our staff using the Environmental Stewardship Network. So in our theatres, 35% of theatre waste is coming out of landfill. That's over 1,800 litres volume of plastics a week that is diverted from landfill. In our pharmacy department, we've created a product stewardship program where we're actually sending packaging back to the product companies. So, for example, Baxter will send us thermal supplies, but we're sending that thermal packaging back to Baxter and it's now in a circular loop. So we're not actually just using things once. We also, for example, you can see that we've got lots of syringes. So in our pain meds, you'll always get one little syringe when you open up a Panadol. So instead of putting those in the bin, the pharmacies keep those and we divert those into international aid. We've developed a really clever soft plastics recycling program. Soft plastics is LDPE and it's quite viable on a recycling market here in Australia, but they only really want the clear and clean plastic, and we have a fair bit of that in hospitals. So we've been really targeting some of the simple, quick ones. So that's II covers, microscope covers, but I'm also drilling down to the back of a 10 ml syringe. So when you're opening up a 10 ml syringe, that soft plastic can go into soft plastic and the paper that was on the other side can go into paper recycling. We've also developed a really unique battery recycling program where we actually steward across all of our organisation to ensure we capture every battery, and we've recycled 2.1 tonnes in 1 year, and that's quite a large volume of batteries. So then what we've done with that is we've actually segregated into different battery streams, so not just your lithium. We advocate for children's paediatric safety, obviously, that button batteries do not exist for children's safety, so we advocate that they don't belong in our hospital, and we have policies around that. So we capture those if we do have them in a separate stream. But then I've also advanced to do a lead battery. So a lot of the BTS, the biotechnology, comes out with lead, and lead batteries are worth $400 a tonne. So instead of putting them into one battery bin, we're working to segregate them all out so that I can actually rebate and return an income. So building financial sustainability around environmental sustainability. The next one I've tried to do in our recycling revolution is look at metal. So metal is really important to capture in hospitals because you mine the earth, you take those resources from the earth to create metal, but it doesn't make sense to put that back into landfill. Because also, before when I was speaking about, there's actual money, there's rebate in metals. So what I've developed through product stewardship is a metal recycling program where I capture single-use instruments, laryngoscope blades, copper diathermy wires, and what you're seeing there on the right of the screen is actually tips of catheters that have gold and platinum iridium in them. And I've been getting the clinicians to remove those. And they themselves probably return about $2,000 a month through metal recycling here back in Brisbane. So it's all very locally driven sustainability as well. So in the year of 2020, we moved 10.83 tonnes of metal. That's me giving my little thumbs up there on the dock. But I'm very proud to say that that's from operational services, it's from building reconstructions, it's from clinical staff, it's from all avenues across our hospital to create that big target. And it's actually rebated quite a few $1,000s into the to the financial economy as well. What I do have as well is a timber pallets, because hospitals constantly get timber pallets and we obviously don't know what to do with them. So actually what I've invested in there is engage with locals who come and take those away and repair them, recycle them and put them back into the timber pallets. So that's at a cost saving of $6,300 a year, just from removing those from landfill in another stream as well. Speaking to, following on from our last presenter with our food waste and organic waste, it's really precious organic waste because it's one of those things that should never reach landfill due to methane. And what we do in our hospital is actually, we have organic composting on site. So all food is scraped into an organic compost stream, which goes to the back of Brisbane in a commercial composting program. But we also have an on-site food rescue program. So every non-perishable food is actually captured and sent through to an Oz Harvest rescue food program, which goes into a program that actually assists children who go to school with have no food. So it's really important to look at that overarching food, where we're buying from it, how we're using it, and where we're repurposing it from. We've also built in our recycling, community recycling projects. So if we have our operations and facilities teams fixing a light and there's a few screws and an Allen key left over in the kit, we capture that and I give it to local men's sheds. Our kitchens collect their bread tags and we support Transmutation here in Australia who recycle bread tags back into bowls. So what I'm trying to do is actually look at everybody who comes to work. What are you touching and how can we help other people in our community to recycle? I also support our staff with things that we can give away and build that well-being around staff. So we also have a free moving box program. So I just collect our hospital boxes and you can just email me and I'll fill your boot up with moving boxes when you're moving. And I probably do about 3 staff members a week, to be honest. But also at our coffee retails outlets, we give away all the coffee grinds to staff and community. So it's just really using our resources to give back to the staff. And the last thing I'll talk to you about, and I know I'm talking fast, I'm known for that, but is actually using our built environment. This is where my deep passion lies, is actually looking at our immediate environment. How can you immediately affect the place and the people that we live in? So I have created a horticultural therapy program using the spaces in our hospital. And as you saw from the beginning, it's a vertical hospital with not a lot of opportunity to put trees. But what we've actually done is created community gardens for our staff. We have vermicomposting, so worm farming on site for our staff to have access in. But creating these therapy gardens where staff can actually use it as a communication hub and as a therapy hub, so you can go out and you can pick some mint for your mojito on the way home from work or some rosemary for your lamb, and it's a shared space. So to develop that also is, we've also provided a space for children. So you're looking at there, and this is all completely edible, this garden is a rehab garden for children. So using our built environments in our hospital to enhance people's connection to the environment and to enhance that whole well-being at work. So encouraging our staff to be involved. This is the garden gnomes of the hospital. And just encouraging that interaction with the built environment is really important. And I speak to it in the sense that it's a prescription of nature, particularly going through a COVID pandemic and in children's health can be quite stressful. So really engaging in that built environment and using the organic waste on site and using seeds that you self-harvest in the garden to create these programs. So what I do is I do a monthly program with our children where they garden with me and we use on site, we use our worms and we use all of these programs. So this month, actually, we just made rosella jam. The kids, we had 22 children and we made rosella jam from our level 6 garden. and we're sending that into the Brisbane exhibition. So that's kind of like our show that we have here in Queensland once a year, and the kids are going to the Eka from the hospital. So I'm really tying in that full sense of community and environment around what we're trying to achieve. And I guess the success lies in what I have been trying to achieve is in the way I'm engaging the staff. So this is just an example of internally on our screens. I have a community member of the hospital every month. So that's highlighting someone who's engaging in the garden, who's picked something from the garden for their dinner, or has been composting through the garden. And I highlight them and why they love working here. And similarly, with our sustainability programs, to engage staff, I've created an environmental stewardship award, and this is celebrated on our staff screens across the hospital and in our newsletters. And it's also just highlighting what each department is actually achieving in their hospital. So that's part of the success, I guess, is that effort and reward and creating community around it. So I won't talk anymore, but thank you very much for having me. And I look forward to hearing all the other speakers. So thank you.